Hello, and thank you for coming to my poster. My name is Reem Al-Sharif, and I'm a PhD candidate in the Department of Family Medicine at McGill. Today I'm talking about a study that is part of my larger PhD project that explores the outcomes of people seeking online health information on behalf of others, a phenomenon called proxy information seeking. This is an important topic. Almost everyone searches for health information online, and in several recent surveys, almost two-thirds of respondents report searching for information on behalf of someone else. There are many benefits to this, feeling more empowered, being better able to make a medical decision, but there are also negative outcomes. We found in a recent study about preventing negative outcomes of online health information that discussing the information with others was one strategy to prevent increased worries or harmful decision-making. I conducted a literature review on the topic and found few studies that looked at the outcomes of proxy information-seeking behavior, which led to this study. Our team at McGill has been working in partnership with NAPCRG, a Quebec-based parenting website that implemented the validated and evidence-based information assessment method, the IM questionnaire, on their web pages since 2014. A reader accesses a web page either directly through the website or through a search engine, or through a weekly newsletter that they signed up for. They're invited to complete the questionnaire that asks them who they are, questions about their experience with the information they just read, and if they would be interested in participating in our interviews. This let me conduct a convergent mixed method study. In the quantitative component, I analyzed 2 years of survey responses. And in the qualitative component, I interviewed entourage members, people who identified as grandparents, family members, friends, or professionals working with children, to explore their motivation and outcomes. And for the quantitative component, as hypothesized, when I compared parents and entourage, parents were more likely to report using the information for their child and having outcomes related to that, while the entourage reported using the information in discussion with someone else, or better being able to decide with someone else what to do. This may allow us to conclude that when the information is considered trustworthy, the entourage are more likely to share it with others. While comparing newsletter and website responses, it seems that when the information need is known and the searching is directed and active, as is the case with website respondents, they're more likely to report outcomes such as being less worried, being better able to handle a problem, or being better able to decide with someone else what to do. The qualitative analysis is still ongoing. We interviewed 14 entourage members, and they talked about the context of the information seeking and the online health information seeking behavior itself. They used the information by sharing it with the child's parent, or used it to do something with the child, or they sometimes didn't share it to avoid tension. And they reported generally positive outcomes such as feeling more confident discussing the topic or being better able to support a parent. In the next step, the findings from both components will be integrated to revise a conceptual framework on proxy information seeking outcomes and to revise this IM questionnaire for the entourage, as it has only ever been validated for parents. The results of this project may be applied in other contexts and may help healthcare professionals and information providers better adapt the information to individuals and their social circle. Thank you.